إن الحمد لله نحمده ونستعينه ونستغفره ونعوذ بالله من شرور أنفسنا ومن سيئات أعمالنا من يهدي الله فلا مضل له ومن يضلل فلا هادي له وأشهد أن لا إله إلا الله وحده لا شريك له له الملك وله الحمد يحيي ويميت وهو على كل شيء قدير وأشهد أن محمدًا عبده ورسوله. يقول الله عز وجل في كتابه الحكيم بعد بسم الله الرحمن الرحيم: يا أيها الذين آمنوا اتقوا الله حق تقاته ولا تموتن إلا وأنتم مسلمين. كما قال: يا أيها الذين آمنوا اتقوا الله وقولوا قولاً سديداً يصلح لكم أعمالكم ويغفر لكم ذنوبكم ومن يطع الله ورسوله فقد فاز فوزاً عظيماً. In early 2003, we were afflicted by the epidemic of a virus called SARS. In 2008, MERS. In 2014, the world was gripped by the Ebola and the Zika epidemic, and the lack of knowledge and unscientific speculation about the disease caused great panic among populations across the globe. And now, 5 years later, 2019, the deadly coronavirus is similarly consuming the world consciousness as it spreads into a growing number of countries every day. As of today, we've heard that 90 countries around the globe has been afflicted with the coronavirus. On January 30th, 2020, the World Health Organization declared the new coronavirus as a global health emergency. When we say global, that means it's pandemic. That means it's across the globe. As of now, we know, as of this morning, there's over 98,000 cases, confirmed cases of coronavirus across the globe. 3,383 individual patients have died, and 55,444 patients actually have recovered. In the United States, as of this morning, 233 confirmed cases, and only 12 deaths had happened so far. So the CDC and the World Health Organizations calculated so far, within less than 3 months, that the mortality rate of the coronavirus is anywhere between 1% and 3%. It is still small, but it's still a global pandemic that we should be on alert of it. The coronavirus is a large family of viruses that causes illness that range from common cold, sneeze, cough, to more severe diseases. When we heard about the SARS, which stands for Severe Acute Respiratory Syndrome, in 2003, 2004, and then later on, 5 years later, we heard about MERS, the Middle Eastern Respiratory Syndrome. These belong in the same group of viruses. And these viruses, the coronavirus, is a novel one. It's a brand new strain that have never been identified in humans. What are the common signs of these infections? It's something that you're familiar with common cold. It's fever, cough, short of breath, and fatigue. When you listen to these symptoms, this is just the symptoms, again, of a common cold. And that's why a significant amount of patients actually have recovered from the virus. But in more severe cases, it can cause pneumonia. It can cause severe respiratory distress to the extent that the patients need to be admitted to the hospital or intensive care and need to be on a ventilator. It can lead to kidney failure, organ damage, and even death, such as in these 12 cases so far that's reported in the United States. Scientists have exhorted themselves to know where is that virus came from. And according to the scientists, the coronavirus came from bats, which is still unknown where and how the virus jumped from these bats to human beings. They, however, speculated that the coronavirus came from a large animal and seafood marketplace in the city of Wuhan in China, where the coronavirus has been originally reported, and now the city is completely shut down. There are also reported cases of all over the globes, and we try to understand why some of these cases that never been in a countries that hasn't been infections or infected, why these patients have. So there's still a lot of scientific work that need to be done. But what we know that the numbers are increasing daily. We are following the outbreak of this deadly coronavirus in China and across the globe with grave anxiety. And in this khutbah, I would like to reflect on how we as conscious Muslims and responsible global citizens should respond to this new outbreak or coronavirus. How should we respond to this epidemic? First and foremost, this life-threatening respiratory disease, which is caused by a virus. When we talked about a virus, it is unseen by the naked eye. And subhanAllah, when you look at the molecular structure of it, the structure of this virus, if it's a small organism, again, it's unseen by the naked eye, and surrounded on the surface of this, there is parts of, like pigs, like pearl things that goes, looks like a protein. It's called glycoproteins. These pegs basically allow the virus to attach itself on surfaces when it lands on it. And it's hard to get it out unless, of course, what we talk about, the washing the hands or so on and so forth. But regardless to say of that this life-threatening respiratory illness or disease that is highly infectious should really remind us about the transient nature of life and move us all to redouble our commitment to live wholesome and virtuous life. Diseases like the coronavirus is a stark reminder of our ultimate destiny. This is the concept of frailty of life, the inevitability of death. In this regard, the glorious Quran advises about the reason of the creation of the human being. In the famous opening verses of Surah Al-Mulk, which we read often, Allah, the creator and the taker of life, the muhi and the mumit, proclaims the following: تبارك الذي بيده الملك وهو على كل شيء قدير الذي خلق الموت والحياة ليبلوكم أيكم أحسن عملا وهو العزيز الغفور. Blessed is Allah, unto whom belongs all the dominion and has the power over all things, the one who created death and life as a test, in order to determine which of you is best in conduct. Allah is all-powerful and most forgiving. The scholars and commentators of the Quran have been intrigued to discover why death is mentioned in these verses before life, before mentioning life. And it's my considered view that death is mentioned before life simply because the test of death is perhaps of greater significance than the test of life. And the one who often remembers his or her mortality, this short life that we're living, will be inspired to do good deeds and to live a virtuous life. In support of this view, one could cite several ahadith or prophetic traditions that exhort the believers to constantly remember their mortality and that life in this world is very transient. Second, it is really important to realize that according to the Quran, life is a trial or a test. This life we see a lot of ibtila, which may take the form of a distress, but also remember that it can take also the form of ease, of comfort. The Quran predicts that inclination of human beings would be to interpret the ibtila as a distress, as a sign that Allah subhanahu wa ta'ala has forsaken and punished you. But conversely, comfort, ease of life are interpreted as a sign that Allah has blessed us. Such a perspective is given us in Surah Al-Fajr, when Allah subhanahu wa ta'ala said, فَأَمَّا الْإِنسَانُ إِذَا مَا ابْتَلَاهُ رَبُّهُ فَأَكْرَمَهُ وَنَعَّمَهُ فَيَقُولُ رَبِّي أَكْرَمَنِ وَأَمَّا إِذَا مَا ابْتَلَاهُ فَقَدَرَ عَلَيْهِ رِزْقَهُ فَيَقُولُ رَبِّي أَهَانَنِ. As for the human beings, whenever the Lord tests him by being generous to him and allowing him to live a life of ease, he is prone to say, my Lord has been gracious to me. Whereas whenever Allah tries him by straining the means of his livelihood, he's prone to say, my Lord has disgraced and punished me. Third, in the light of the above evidence from the most primary sources of Islamic guidance, we should cast aside the view advocated by some Muslims that catastrophe, such as the deadly coronavirus outbreak, is a sign of punishment for the Chinese government's persecutions of the Uyghurs populations. And we've heard that from a lot of scholars even across the world. Again, it's my considered view that such deliberate allegation or viewpoints deny the divine justice of Allah, who is al-adl, the absolute just. No one among us is qualified to speak on the behalf of Allah. We are not in a position to declare why something is happening or to link a general tragedy to a specific evil that happened around us. How does one account for the fact that only China is being chastised by Allah, whereas other communities of equal or even greater sin and oppression are being left unpunished? Or how one does account for the fact that innocent children and even good, decent human beings are being killed every day by the coronavirus? Rather, we say, as Prophet Muhammad sallallahu alaihi wasallam said, when our mother Aisha, may Allah be pleased with her, asked him about the plague, and he said, this is a punishment that Allah sends upon whoever He wishes, but Allah has also made it a mercy for the believer. So whoever is afflicted with a plague in his town, and he remains in it, patient, expecting Allah to reward him, knowing that nothing shall happen to him except that Allah has decreed, shall be rewarded the rewards of a martyr. So we learn that yes, every single disaster, personal or communal, can be a result of a sin and has the potential to be a punishment. But we do not link it to any one sins or crime. We are not in a position to speak on the behalf of Allah. And we also give hope to those who are in such places. Turn to Allah, seek His help, and be patient. And know that nothing happens except with the decree of Allah. We do not cause them to feel bad or claim they are going to be punished or, God forbid, gloat over their tragedy as some seem to be doing lately. Every single disaster, personal or national, has the potential to be a punishment. Rather than stand in judgment of these suffering souls, we should be praying for them and provide them with solace and hope. Moreover, the coronavirus is not afflicting only the Chinese, but has already spread to other countries, and if not curbed, it has the potential to affect all of us. And this leads me to my fourth point. Muslim infectious disease specialists and medical researchers should be at the forefront, providing the world with support of a vaccine development and assist in discovering a clinical cure for this coronavirus. For the Prophet ﷺ clearly has encouraged us with the following teaching. There is a remedy for every malady. Dawa'un likulli da'. Fifth, as conscious Muslims and responsible global citizens, we have the responsibility to assist with educating people about the measures we could take to protect ourselves from the coronavirus. In this regard, I have two suggestions gleaned from the teaching of the Prophet Muhammad sallallahu alaihi wasallam. The first is not to travel to any area, whether China, Italy, or any of these provinces where the coronavirus is spreading. Such a position is supported by the Prophet Muhammad ﷺ advice to his companion to not to travel to areas and places not to be afflicted with the illness of leprosy. He also has advised those in contaminated areas or communities not to leave and spread the disease further afield. There is this famous incident in the Sirah in which Umar ibn al-Khattab was heading for Al-Sham. When he reaches a place in Syria called Saraf, he came to that point and he came to his knowledge that there is an outbreak that is most likely the plague. Then Ammar ibn Auf told him, the Prophet ﷺ said that if you heard the news of it, meaning, then do not enter this place. If you hear that there is a plague in a land, do not enter it. And if it visits a land while you are in it, do not go out of it. So Umar ibn al-Khattab radiallahu anh listened and did not continue his journey and return back to his hometown. The second suggestion to protect us from the coronavirus is to encourage people to simply wash their hands, especially after they have been in public areas and visited bathrooms. The contemporary research over and over again have shown that personal and environmental hygiene, especially hand washing, can reduce the spread of infectious disease very effectively. Scientists have now all agreed that simple hand washing with water and soap is one of the most effective methods of prevention. As a matter of fact, there is even a recent Chinese study that showed that hand washing with, again, simple water continuously for 30 seconds is more efficient than using a hand sanitizer in preventing the flu infection. So as we see, Islam is a holistic system and it takes account into the physical, emotional, and spiritual well-beings. أقول قولي هذا وأستغفر الله لكم استغفروه إنه هو الغفور الرحيم. بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد وعلى آله أجمعين. So as we see that more than 1400 years ago, the Prophet Muhammad sallallahu alaihi wasallam, may the mercy and blessing of God be upon him, was teaching his fellows, human beings, his companions, practical hygienic practices that are still applicable to the 21st century, which are known to us. So through the traditions of the Prophet Muhammad, we find evidence that clearly indicate Islam's stance on coughing and sneezing openly. The Prophet ﷺ instructed the believers to cover their faces when sneezing. The most obvious effect of sneezing and coughing without covering the face, of course, is the spread of the airborne bacteria and viruses. In addition, droplets invisible to the naked eye may fall into surfaces or on other people as well. According to the Center for Disease Control, CDC, in the United States, the virus that causes SARS and the coronavirus are thought to be transmitted most readily by respiratory droplets produced when an infected person coughs or sneezes. This is known as droplet spread, which can happen when the droplets of the cough or the sneeze of an infected person are propelled a short distance, up to 3 feet, through the air and deposits on the mucous membranes of the mouth, nose, or eyes of the person that is nearby. But the virus also can spread when a person touches a surface or object contaminated with this infectious droplets and then touches his or her mouth, nose, or eye. The coronavirus also might spread more broadly through the air, and that's called airborne spread. In this regard, the glorious Quran and the Sunnah, the exemplary conduct of our spiritual guide, our Prophet Muhammad sallallahu alaihi wasallam, contain numerous teachings that promote personal and environmental hygiene as a religious obligation, technically known as fiqh at-tahara. So Muslims, again, are obligated, as we know, wash themselves with water every time they visit the bathroom, to make wudu by washing their limbs before each of their 5 daily prayers. These discipline of personal hygiene and hand washing need to be really, really stressed at this critical time, and the prophetic wisdom shared tactfully and gently with ours. Both the World Health Organization and CDC recommend the following precautions. Cover your nose and mouth with a tissue when you cough and sneeze, and dispose the tissue in a trash after use. Wash your hands often with soap and water for at least 30 seconds, especially after you cough or sneeze. Avoid touching your eyes, nose, or mouth. Germs spread that way. Stay home if you get sick. CDC recommends that you stay home from work, school, and limit contact with others to keep from infecting them. And lastly, I would urge everyone who becomes ill or have suspicion of these symptoms to seek the treatment from his qualified physician or health department. In conclusions, we should not forget that dua is the most powerful thing. We should not create panic by spreading misinformation, but constantly make a dua and pray to Allah al-Shafi, the source of all healing, to protect us, our families, communities, and indeed all of our brothers and sisters in humanity from the coronavirus across the globe. And I end with a supplication recommended to us by the Prophet Muhammad sallallahu alaihi wasallam when he said, Allahumma inni a'udhu bika min al-baras wal-junun wal-juzam wa min sayyi al-asqam. O Allah, we seek refuge in thee from leprosy, insanity, elephantiasis, and harmful disease in this in itself. So protect yourself with all the measures that we talked about it, and above all, protect yourself from dua for you and your family. And Allah subhanahu wa ta'ala, Rasul sallallahu alayhi wa sallam also, عن عثمان بن عفان رضي الله عنه قال سمعت رسول الله صلى الله عليه وسلم يقول من قال بسم الله الذي لا يضر مع اسمه شيء في الأرض ولا في السماء وهو السميع العليم 3 مرات لم تصبه فجأة بلاء حتى يصبح ومن قالها حين يصبح 3 مرات لم تصبه فجأة بلاء حتى يمسي. If anyone says 3 times in the name of Allah, whose name is mentioned, and nothing on earth or in heaven can cause harm, and He is the hearer and the knower, he will not suffer sudden affliction till the morning. And if anyone says this dua again in the morning, he will not suffer sudden affliction till the evening. قولوا قولي هذا أستغفر الله لي ولكم وأقم الصلاة.